was like you wanted to wrench your own brain out and, you know, have it clean somewhere or leave it there or just depart, and you went one place and it went the other. And it's amazing because I had never, even physical pain, you go to sleep from, or there's morphine or there's something, but nothing put the silencer on this stuff. And it was just the most agonizing experience I have ever had. And I don't want it ever again.
It is estimated that 1 in 40 people in the United States may suffer from the anxiety disorder known as Obsessive Compulsive Disorder, or OCD. It is the 4th most common psychiatric disorder and twice as common as schizophrenia. If you believe you or a loved one may be suffering from OCD, you're not alone. You've also made the right decision. Seeking help is the first step to feeling better. Patricia's symptoms first began in childhood.
Here at age 9, I was refusing to answer questions yes or no because I thought they might be a lie, and I wouldn't touch anything because I thought it was somebody else's and I would be stealing. I remember going to school and I had my lunch in a paper bag, and I wouldn't eat my lunch because I couldn't be sure that it wasn't somebody else's lunch, and then I would be stealing it.
For Richard, the symptoms began during his freshman year in college.
I couldn't stay in rooms for a test. I had to always keep running out of the room. And the obsessive thoughts were starting to come in and out during that period. They dealt with the issues of hurting myself or someone else, especially if I was driving a car. I'd be afraid that I was going to swerve into the other lane and crash into the car. If there were people walking along the sidewalk, I'd be afraid that I'd run the car off the road into people on the sidewalk.
Yet while Patricia and Richard both exhibited typical symptoms, there is no such thing as a typical OCD patient.
It's a kind of disorder that can afflict anybody of any age, of any gender or race. About 50% of cases of OCD begin in childhood, and some studies have shown that it's been as long as 17 years on the average before somebody actually seeks psychiatric help.
Richard experienced obsessive thoughts. Patricia's obsessive thoughts led to compulsive behavior.
An obsession is really an unwanted thought that the person feels invaded by and focuses on, even though he or she would wish not to. A compulsion, on the other hand, is having to do something. So an example would be hand washing would be a compulsion. An obsession would be the intrusive belief that if one does not wash one's hands, some terrible ill will befall that person.
And I was doing things like going down in the middle of the night to check files to make sure that things had been done correctly, checking everything, making phone calls over and over again.
It continued to get worse, especially the obsessive thoughts, and I associated those more with going crazy, realizing I needed some type of psychiatric help.
So what happens is you get this thought in your mind that anybody else might have, like, did I leave the stove on?
The more nervous you get about them, the more they increase, and then you get more nervous about them, and it's like putting heat under a boiling pan of water, you know.
And you would go, well, okay, did I do it? And then you'd go, well, what if I don't go back and check? Well, if I don't go back and check, then it's going to heat up, and then it's going to spark, and then it's going to set the pan on the stove on fire. That's going to explode. It's going to burn down the house, which is okay because it's my house. However, my house is 2 feet away from the house next door, and it could burn down their house. And you just, what if, until all of Western civilization has been destroyed because you didn't go back to check the thing? It's absurd because you do not feel that you can resist the impulse. You feel that you have this obligation to do this thing or somebody's going to get hurt and then it's going to be your fault.
Neither knew what was happening to them.
I really thought it was just something physical in the beginning because it had physical symptoms to it. The high anxiety, the panic attacks, disrupted sleep, change in eating patterns.
The first doctor thought it was anxiety, basically.
He diagnosed it primarily as anxiety and depression.
And they tried all sorts of different drugs, and they'd say, here, try this for 2 weeks, or try this for 3 weeks and see what was going on.
The reason that OCD is undertreated is really twofold. One is the failure of health professionals to do proper screening in cases where there's a high prevalence of OCD, is comorbidity with depression or anxiety, for example, and also the reluctance of the patient himself or herself to divulge the information because they really think that they have a deficiency or that they have a weakness rather than a identifiable, legitimate medical problem.
Well, I was really amazed when I found out from Rich that, he had these fears of train platforms and driving cars and, et cetera, because he never expressed them, and I just didn't know about them.
For both Richard and Patricia, it was in early adulthood that the disorder reached its peak.
Changes I noticed when the flare-up started was basically he was not eating, losing weight, and not sleeping. And then, he admitted to me he had a problem, and he called a psychiatrist at that time because, he thought he was having a nervous breakdown, basically.
When it hit, and it finally hit in all its savagery, it completely destroyed all of my life. I couldn't work anymore because I basically couldn't finish anything. If I went to work and started on something, writing a draft of a brief or something, it would have to be written over and over again. And eventually it got to the point where you couldn't even start anything. And basically it spread out from work to home. And I just went to a hospital and said, take me and do something about it.
Fortunately, once it is properly diagnosed, OCD is very treatable.
In the case of OCD, medication is really the mainstay of treatment. Psychotherapy does not seem to be highly effective in alleviating the symptoms of OCD, and certainly wouldn't be if not used in combination with the proper medications. Behavioral therapy can be helpful, but again, is also most helpful when used with medicine.
Both Richard and Patricia eventually found the proper diagnosis and the right treatment at the Yale Mental Health Center, where doctors were testing a new class of drugs called SSRIs.
A number of different antidepressants have been tried in OCD, but the only class of antidepressant that works consistently are the potent serotonin reuptake inhibitors. It's thought that the SSRIs during chronic administration act to enhance the function of the serotonin system.
The greatest gift medicinally to people who suffer with OCD have been the serotonin reuptake inhibitors like Paxil. Those seem to have offered people a level of relief otherwise not available to them, and certainly not available with the low level of side effects that the SSRIs offer.
I saw a significant difference when I took the SSRI medication. Not immediately, but a gradual increase that was, after certainly the first 2 months, was really picking up.
And then all of a sudden, one day I went for 3 hours without anything bothering me. And then you said to yourself, wait a minute, something's missing here. I feel okay.
Rich is doing very well, on the medication. He seems more relaxed with himself and, stress-free. In most instances, the job still gets to him occasionally, like most people. But I see, a vast improvement.
And it was just little windows, and within 5 weeks, it was up to the point where when a thought came into your head, you could say, out, get out. It was amazing. It was absolutely amazing. And you were back where you were a year before that you couldn't, 5 weeks ago, have imagined yourself. It just stopped.
Paxil has demonstrated itself to be very effective in the treatment of OCD. It tends to be well tolerated, so people who need to take the medication over long periods of time can do so without much impairment in their lives. In addition, it's been demonstrated to markedly decrease the obsessiveness and compulsions associated with OCD.
Richard and Patricia both now know that they are not alone.
That was one of the first times I think I really started to realize I wasn't crazy, because it's very difficult if you're in a doctor's office one-on-one to know that anyone else really exists with the problem.
And then you sit down in a room with a bunch of people and everyone's looking at each other, and knowing somebody finally starts and you go, you did that too? And eventually people start laughing and howling because you basically, for the first time in your life, can say, I thought that, I did that, and you can laugh at it because everybody else in that room did it too.
I think the critical things to get across to a patient who you suspect or now know has OCD is to tell the patient that this is not a moral failing, that this is a disorder, that it's not their fault. And despite the fact that they may feel different or ashamed or somehow crazy, this disorder has to do with abnormalities in their brain functioning. and importantly, that there's effective treatment available.
I don't think OCD has a stigma. I think it's, you know, it's like every other disease. It's a disease, and it's treatable. It isn't, I mean, you're not insane or anything like that. You're just sick. It's a sickness that can be treated, and they're going a long way doing it now.
Obsessive compulsive disorder. You don't have to live in fear.